Hello, my name is Katerina Zuniga, and I'm going to be your nurse today. How are you doing? I am here to help you through this process and to explain the operation we will be performing today. We have identified a basal cell sarcoma on the middle of your zygomatic bone, which is going to be right here on your cheek. Basal cell sarcoma is caused by long-term exposure to the sun that turns into a sunburn. Today, Dr. Benavides will be performing Mohs surgery, which is the single most effective technique for removing both of the most common forms of skin cancer. Before the procedure, anesthetics will be inserted into the affected area so that you will be as comfortable as possible during this process. The procedure consists of the doctor removing a layer of the basal cells with a scalpel, and then I will come in and bandage up the wound, where I will assist you to a waiting room where refreshments and entertainment are provided. While you're in the waiting room, the doctor will take your sample back to the lab and look at it under a microscope. This procedure will be repeated until only healthy tissue is remained on your cheek. Depending on the amount of times we have to do the procedure will depend on the duration and the time that it takes today. After only healthy tissue remains, I will stitch you up, and we will determine a time for you to come in next week where we can check your wounds. And depending on how it's doing, we can take the stitches out or set up another time next week to see you. It is important that during this healing process you take care of the wound. We're going to be sending home a pamphlet with you, which gives you all the ways that you can clean out the wound to make sure no infections. If you have any questions, we are always here to answer them for you and just a call away.